Hello everyone, my name is Amina Ali, and today I'm going to be talking about liver disease and the racial disparities related to the diagnosis and treatment options of the disease. A quick overview of what we're going to be discussing today is the racial disparities in liver cirrhosis, related mortality due to an inequality in diagnosis and treatment of the disease, the effects of these racial disparities on minorities, end-of-life care and treatment options for people with liver disease, solutions to fighting against racial disparities in healthcare settings, barriers that pose as disadvantages to those living with liver disease. Chronic liver disease is the 12th leading cause of death in the United States, and the primary cause of chronic liver disease is from several different factors such as hepatocellular carcinoma, hepatitis C virus, heavy alcohol use, obesity, or an autoimmune disease such as primary biliary cholangitis. African Americans and Hispanics receive less referrals for medical care than white individuals for those with hepatitis C virus, otherwise known as HCV. An analysis of 4,000 medical records revealed that 71% of white individuals with HCV had recorded referrals for treatment, compared to only 32% of African Americans and 40% of Hispanics with the disease. African Americans in the U.S. experience hepatocellular carcinoma development at a rate that is greater than double that of white individuals, and they are twice as likely to be HCV positive. Nonetheless, African Americans also are less likely to receive liver transplantation and have a lower percentage of patient survival among those who receive transplants. According to a National Health Interview survey, in comparison to white individuals, African Americans and Hispanic participants had lower rates of HCV screenings. There is also evidence of racial discrepancies in medical treatments, including operations and endoscopy procedures. African Americans and Hispanics were less likely than white individuals to undergo ascites and variceal hemorrhage procedures, according to a statewide study of 63,000 patients with cirrhosis and portal hypertension between 1989 and 2003. Compared to those covered by Medicaid and those with private insurance, the uninsured had the lowest treatment rates overall. Medicaid is also linked to a larger percentage of coverage denials and reduced probability of treatments for patients. The solution to this is to first spread awareness of the problem. Knowledge of cirrhosis is minimal in disadvantaged groups. A study from 2014 showed that 69% of people with cirrhosis are unaware of their diagnosis. Among the unaware are from disadvantaged backgrounds such as African Americans and Hispanics. Another solution is to improving the number and capacity of providers in economic disadvantaged communities via Medicaid. For example, 28% of Latinos and 22% of African Americans have reported having little or no choice in where and how to seek care, while only 15% of white individuals reported this issue. Another way to fight against racism in healthcare is to employ and promote Black and other underrepresented healthcare professionals. American Liver Foundation aims to help promote education, advocacy, support services, and research for the prevention, treatment, and cure of cirrhosis and liver disease. They also offer programs and events for people suffering from liver disease and offers the latest news about clinical trials of the disease. Ways you can help is by voting for candidates that improve healthcare reforms and also that help fix health disparities that are currently present today. A good way is volunteering and signing up for American Liver Foundation emails and calls towards action. Volunteers can also participate in town hall meetings, health fairs, and other public outreach areas to promote issues surrounding liver disease in disadvantaged communities. Some volunteers may not have time to go to outreach events, opportunities, and advocate for liver disease. A way to fix this is that volunteers can email and spread word on impacts of health disparities virtually as well as contribute to donations online. One way to help improve health disparities is to support healthier food options in disadvantaged locations. High fat and carbs can lead to liver fat, which can contribute to cirrhosis. To help offset this, volunteers can help lower economic neighborhoods that have food deserts and less viable options for fresh fruit and vegetables. One of the barriers to maintaining good health and wellness is due to a limit in healthy food options and physical activity. All in all, there are many ways to change the current state of the healthcare system, specifically the racial attributes found today. One way to combat racism in healthcare is to include historical background and anti racism teachings in medical school courses. This can help educate future professionals and help provide better care for minorities. Hospitals can also employ specialists with experience addressing institutional racism. In conclusion, racial disparities play a big role in access to care and treatment options for minority groups such as African Americans and Hispanics. Volunteering and helping address inequality in the healthcare system is the first step in making a difference. These are my references. Thank you.